Welcome back to the one and only The Mega Rich channel. Okay guys, passed my NCLEX in 60 questions. So I took my NCLEX on September 23rd. And I scheduled a month before that. So I studied for 30 days. I used the Saunders NCLEX study prep book as well as hers. And I used hers literally the last 2 weeks of studying before my NCLEX, and all I used was the study simulator test. It actually tells you if you are likely to pass NCLEX or not if you make a certain score. For Saunders, I used every single question in their test bank, and I didn't start with my weaknesses. I actually went by categories, like, you know, whether it was respiratory or GI. That's pretty much how I studied for NCLEX. I really did like Saunders. I felt like hers had more challenging questions when it came to the test simulators. But then again, they had a few questions from Saunders that was also on NCLEX. But I really advise people to use hers because I feel like if you study with hers, at least doing the test simulators, you'll feel more confident because the NCLEX really felt like I was on a hers exam. If not, I really felt truly that the NCLEX was easier than hers because NCLEX had like more simplified questions. And I think because hers asks more difficult questions, it just pretty much prepares you for the NCLEX because it has you thinking critically. And when you get those easy questions, you're like, wait, this is way too easy. I think I'm picking the wrong answer. And that's how I felt. But thank God I did pass. So yeah, so the more questions you do, the more prepared you're going to be for NCLEX because you just don't know how many questions you're going to get. And the more questions you answer, the more confident you'll feel in the material. So that brings me to my job. So I start my job on October 12th on orientation. That's online. And then the Tuesday I actually go into in-person orientation just to tell me a little bit about the hospital, what systems they use, like, you know, what standard protocols, learning how to use their AccuCheck machine, and also being introduced to the equipment they use because where I did clinicals at, it's not the same hospital that I applied to and got the job. So yeah, it's going to be a lot. And also learning how to chart in their system and meeting with my manager, knowing the rules, knowing what kind of uniform I can wear, how my hair is supposed to be, and just things of that nature. Where I work, they have a really strict hand hygiene policy, so you can't wear any artificial nails, no shellac. It can just be your real nail, very short, regular polish that you buy from Walmart, which is fine with me because I'm not really big like that on nails, and I'm a real germaphobe anyway, so it didn't change my life. And so next week I have a second week of orientation, so I will definitely be recording and documenting so you guys can see how that goes and how my experience goes. And I hope you all enjoyed my video. If y'all have any more questions about NCLEX or how I studied, just let me know. I didn't want to talk too much and feel like I was giving a lecture or something. So I'm more than happy to help you guys. Guys around next time.
So how you feel? How was the first day?
It was good. It was interesting.
Long?
Very long.
See, you got your
Got a lot to learn.
LPN book. Okay. You got your scrubs. Okay.
My nursing bag.
All right, nurse. Yep. Okay. Life of a nurse.
Life of a nurse.